Today we will discuss about how this chronic pancreatitis could lead to malnutrition. So before directly going into the topic, let us first understand few a brief overview about this pancreas. So pancreas has two different sections. First one is exocrine and another one is endocrines. Exocrines are responsible for generating these digestive enzymes, whereas endocrines are responsible for uh, generating these pancreatic hormones such as insulin, glucagon, and some other pancreatic hormones. And this is the zoom-in view of this endocrine sections. Here we can see that echinacea cells where the pancreatic cancers usually begins, and these are the alpha cells, beta cells, and other portions of this endocrines section of the pancreatic organs. So pancreatic organs is divided into the three sections: head, neck, and tail. So and so this is a general overview about the pancreas. So how this chronic pancreatitis developed. So when person takes some of the products such as alcohol or tobacco, it will generate or triggers it will triggers this immune cells to reach to the site of this pancreas. And if these habits of taking alcohol and tobacco continues, then it will activate this pancreatic stellate cells, which is usually present in a quiescent stage. And once they are activated, that is pancreatic stellate cells get activated, then it will create a macro environment with different compositions, and this macro environment will also act as a physical barrier, and at the same time it will create problems to the pancreas, such as it will generate this hypoxia condition, which is nothing but a lack of oxygen within this pancreas. At the same time, the fibrosis are formed around the pancreas, and because of the intercellular changes, it will also generate the oxidative stress. And this kind of conditions will lead to this chronic pancreatitis. And what will happen because of this is that the exocrine sections and endocrine sections will not be able to perform normally, and the digestive enzymes which are secreted by the pancreas, and then with the help of duct it will go into the intestines, so that process will be disrupted. And when this digestive enzyme process gets disrupted, and people will not be able to consume enough food necessary for their daily activities, and with time it will cause malnutrition to that person or person or patients that are affected with this chronic pancreatitis. And this will further aggravated the disease condition within the patients. So what happens when the person reaches this stage? It leads to this chronic pancreatitis, that is duct obstructions will occur, and that will also and what will happen that 80% of the cases, the people remains asymptomatic. However, in the 20% of the cases only, the patients get some of the symptoms, and some of the symptoms could be mainly due to the factors that I mentioned in this figure. First one is that a pseudocyst will be developed in this artery, and that will leads to the pain to the patients. At the same time, this obstruction in the binary duct and duodenal duct obstructions will also occur, and this venous thrombosis formations will cause further aggravated pain to the patients. So these are some of the complications that is occurred because of the daily habits or regular habits of consuming alcohol and tobacco. And this is the actual image of the patients. And here we can see that the the lymph node are aggravated because of this cyst formations, and the obstructions that is being shown here by the arrows. And and if this condition continues for a longer period of time, it will further lead to this pancreatic cancer, in onset of pancreatic cancers. And from that, as we know that pancreatic cancer is aggressive cancers, it's difficult to prevent pancreatic cancers from the metastasis at this point of time. And so it's very essential to have a control on the eating habits and drinking habits. So I hope you now got an idea how this chronic pancreatitis leads to the malnutritions, and if this and in future it might also leads to the pancreatic cancers conditions. If you need to understand more about this chronic pancreatitis topic in detail, you can go through the reference that has been provided in the description. That's all for this video. Thank you for your time.